See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Welcome to a special episode of See You Now. I'm Shauna Butler. As a podcast focused on how nurse-led innovation is strengthening our healthcare systems, advancing health equity, and transforming lives, we wanted to take this opportunity to celebrate, honor, and embrace the rich history of Juneteenth. June 19th marks the day in 1865 that enslaved people in Galveston, Texas, received the long overdue news that all persons held as slaves had been freed by President Abraham Lincoln's 1863 Emancipation Proclamation. More than 250,000 enslaved Black people in the state embraced freedom by executive decree in what became known as Juneteenth, or Freedom Day. And in June of 2021, Juneteenth became a U.S. federal holiday. At its heart, Juneteenth celebrates and magnifies resilience, hope, self-determination, citizenship, democracy, and the journey and freedom of Black people in the U.S., and the opportunity to lift up and make space for the numerous contributions that Black people have made to American culture, science, and innovation, and to our health, particularly as we amplify and elevate the nurses who are leading health equity work. While meaningful progress has been made, there remains so much more to do. We need to double down on our efforts, be accountable, and move swiftly and boldly in our race to health equity. So, in honor of Juneteenth, See You Now is joining the commemoration and celebration with a playlist highlighting the scholarship, innovation, leadership, and contribution of Black nurses toward building healthier communities, families, and experiences. So crank up the volume and let's kick this sampler off with episode 87, Tackling Black Men's Health.
So my name is Dr. Julius Johnson. Everybody that knows me calls me JJ or Dr. J. And yes, I have a doctorate of nursing. I am the president of the Greater New York City chapter of the Black Nursing Association. I'm an associate professor, chair, and I coach football. And I don't say all of that to brag, but I say all of that so I can tell you where I actually come from. I'm from Brownsville, Brooklyn, New York, which has the most New York City projects per square foot in the entire United States. I have friends that were killed as I was growing up. I have uncles and family members and friends that died prematurely. And I say that because it has created a frustrating issue of how do we get Black men to care about their health? For those of you who don't know, Black men has consistently ranked the lowest in terms of health outcomes. Cardiovascular disease, diabetes, hypertension, prostate cancer, lung cancer, you name it, we tend to either be on the bottom of the barrel or near the bottom of the barrel. So for myself, as someone who come from this neighborhood but have accomplished all these great things, I'm supposed to be responsible for creating some sort of a bridge. So one of the things that we set out was, where do we first find these Black men? Because you have to find them before you can even get them to meet a doctor. Then also, where do they feel safe at? Because it has shown over and over, they don't feel safe in doctor's offices. They do not feel safe inside of hospitals. There's a feeling of you being rushed. There's a feeling of you not being heard. And most importantly, it's just a feeling of you not being seen overall when you go into these spaces. So how do we change that? And one of those ways was, let's get them in a safe space. And one of the safest spaces for us is barbershops. Like when I tell you, men go to a barbershop on a Saturday or a Friday night and will not come home to their wives until as late as possible, right? You walk into a barbershop and you can smell the fresh scent of aftershave. You can feel the hot towel on your face. You can feel the alcohol burning. You can hear the laughter when you walk in. And on top of that, a barbershop also serves as therapy for counseling. It serves as violence prevention. you serve as political debates, and then everybody thinks they're also a sports expert in a barbershop, right? So we decided to leverage the fact that we come from these neighborhoods. We know what it's like to be in a barbershop, and we're going to leverage it with us being healthcare experts and how that we can now reach them and talk to them in these barbershops. So we had some great partners over in Sacramento, our Black Nursing Association chapter there, and we decided, let's start doing barbershop health talks. Let's stream them live, sometimes once a quarter, but then let's also just do them normally by ourselves. And it opened up this gateway to talking about health in a very unique instance. A lot of times when things happen in communities, we share the bad stories over and over. And those bad stories, such as Tuskegee experiment, such as seeing family members who don't get proper health care or proper treatment. And those stories are passed on from generation to generation, right? I wasn't directly affected by Tuskegee experiment, but I was told by it by several family members. So you had that kind of perception. And when you talk about trying to get that community to trust in things, and you look at some of the Black men and all the things that we suffer from, and then you have me as a healthcare provider sitting looking at all of the treatments now that we can do to prevent these diseases, to treat these diseases, to minimize these diseases, and you see people not utilizing the services, and really have to find a bridge as to why are people not utilizing them? And being in a unique position where I can see a lot of Black men, whether that's through football, through barbershops, through the Black Nursing Association, or through just walking and really paying attention in my community. And my biggest novel approach is to make sure that I am prepared to take whatever they throw at me because I'm a healthcare provider. Meaning there are things that the healthcare system did to them, did to generations of their family that makes them distrusted. So when we start the healthcare conversation, oftentimes I get that thrown at me as if I'm personally responsible. What I do, because as a healthcare provider, that's something that I have to own. Even though I had nothing to do with it, I have to own because I'm a part of that system, right? And a lot of times when people have historical issues, there's always this comment of, oh, but that wasn't me, that wasn't my people, I didn't have anything to do with it, I'm just representing them now. But I understand that when I own it and say, yes, we did that and we made that mistake and that was wrong, it kind of unarms them for us to start having a conversation. We're going to have multiple conversations. I'm not going to change their mind overnight. I'm not going to change their mind with one conversation, no matter how long it is. I have to get back in front of them to have that conversation. Those are really my biggest practices because I realize that it builds a relationship with those men. And as long as I can build a relationship, we can have future progress.
Episode 93, Double Disparities in Cancer.
My name is Tamaya Nolan, and I am at the University of Alabama at Birmingham as the Associate Director for Community Outreach and Engagement at the O'Neill Comprehensive Cancer Center there. And I'm a nurse. My development as a nurse scientist is deeply rooted in my development as an individual. I grew up in a very small town called Brewton, Alabama, and I always say that it's a town where it's one of everything. We have one Walmart, there's one big grocery store that everybody mostly goes to, but there are two schools. And so I went to the county school, which was W.S. Neal. Every morning, go to my grandmother's house, and I would be a part of my grandmother's routine, which was, okay, you wake up, you take your medicine, you eat your breakfast. And that was what she did. I thought it was normal. And growing up, becoming a nurse, then you find out that no, that's not normal and that's not ideal. And so always had wanted to make a difference in people's lives like my grandma. I can't really remember a time when I didn't think about healthcare. Moving into practice, I began in hematology oncology at UAB, saying, okay, how can I improve quality of life for individuals who have only a few months or even days or weeks left? What can I do to improve quality of life? Breast cancer survivors, they tend to live a lot longer than people who are diagnosed with leukemia. And so you have a lot longer time to be able to think about things like quality of life and how people might begin to use different strategies to improve their outcomes long term. What I identified was that there were a lot of women who were young and Black and had breast cancer. And what I did not see at that point in time was that, there's not a whole lot of research that talks about that experience. And so in talking with these women whom I had met through the Young Breast Cancer Survivorship Network, they were saying that I just don't see me in this survivorship space. I don't see that when I pick up magazines that have information about breast cancer survivorship, I don't see Black women featured. I go to the infusion center and I don't see people who look like me. And people whom I'm sitting beside say, I have cancer. Do you have cancer? You're too young. So I wanted to know more about these Black women. And in doing the research, I found that Black women who were less than the age of 45 were more likely to be diagnosed with breast cancer. That wasn't the same at that point in time when we looked at the larger cohort of women in 2013 and 2014. It was really more so white women who were being diagnosed. But when we look at that younger demographic, it's Black women. But not only that, Black women were more likely to also die. And even to this day, Black women in comparison to white women are about 40% more likely to die of breast cancer. And so I was like, this is a huge disparity. This is a double disparity because these are Black women, number one, but then they're also young. And so I wanted to understand how I might improve quality of life in young African-American women. That is the impetus of my scientific journey, seeing how that might translate into a work of love for me to young Black women. As I talk to students about nursing and the importance of looking at a patient as a whole person, I really begin to bring it back to their own situations, their own home life. I can't separate who I am, my identity, my upbringing, my training. I can't separate that as I go into these spaces that I'm living and being and trying to make a difference as a nurse scientist. And so I tell them the exact same thing. Remember where you come from. Think about your patient as a family member and how what your family member has been subjected to, what your family member has been born into, how that affects their decisions that they make and the outcomes that happen because of that. Representation matters. It absolutely matters. Allowing people to see what they can be and see what they can do is so important.
Episode 100, The Untold Story of the Black Angels. And immediately following that, it's episode 101, Calling All Game Changers and Trailblazers.
We are bringing the history to life of two amazing women, Virginia Allen, one of the last surviving Black angels who helped cure tuberculosis, and Maria Smilios, author of The Black Angels, The Untold Story of the Nurses Who Helped Cure Tuberculosis.
The story of the Black Angels is the story of these women who saved tens of millions of lives with the advent of isoniazid and being on the front lines, and in doing so changed the course of history.
We traveled to Washington, D.C. to join the DNPs of Color Conference and their call to nursing's game changers and trailblazers, and meeting the last known living Black angel, Nurse Virginia Allen.
Virginia Allen, at the age of 16 in 1947, joined the staff at Seaview Hospital in Staten Island, New York, which was one of the few public sanatoriums open to treat patients with tuberculosis. She worked there for over a decade, serving on the front lines, caring for patients until a cure was found for tuberculosis in 1951. Now, Virginia's story is not only inspiring, giving her individual contributions, but she represents many Black nurses throughout the early 20th century who endured a long battle of discrimination and challenges as they fought for their space in the nursing profession.
She will tell you she lives in the restored nurses' residence, which is surrounded by the hollowed-out buildings of Seaview. And she took me on a walking tour, and she pointed at the buildings, and she started telling me the story. And it was there where it began to unfold. And that is how I came to this story. And surprisingly, the most surprising thing was that it had never been told. And I kept saying to her, "Do you understand what you did?" And she said, "We did our job." And I said, "No, you did more than your job." When Virginia said, "Tell this story and put it together," and I thought to myself, okay, there are no archives. This is going to be an oral history. And so the first thing I did was I knew I had to listen. I started with Virginia, and she introduced me to the families of the nurses. I listened, I decentered myself, and it took years of me just hearing their stories, and the narrative arc of the story of the Black Angels came from them. It is a collection of their voices, and then I, as a historian, began to overlay the bigger global events. The Great Depression, the Great Migration, World War II, and then as I started to get more micro, focused into the history of the profession of nursing, I was like, wait a second, these women, they endured immense amount of racism within the profession, because the same country that drew lines around water fountains and bus stations drew them around hospitals. And this was no easy task for these women who were promised certain things when they came up to New York City in the early 30s that never materialized. They experienced the same kind of placards on the dining room tables at Seaview, the same kind of inability to transfer. And so that is really the story of the nurses, is oral from them, from these hundreds of hours of interviews.
I was led to nursing through my aunt, Edna Sutton Ballard. I admired her, and of course the white starched uniforms. And when I was 16, I graduated from high school, and I asked my parents if I could move to New York to be with my aunt and go to nursing school. I just felt that I wanted to help people. There were 20 city hospitals. Of those 20 hospitals, only 4 hospitals hired Black nurses, which was ridiculous, especially since there was a nursing shortage. And Seaview Hospital especially had a shortage of nurses. The training I received from the nurses at Seaview, we had a big education department. And the training I received has served me well. I enjoyed what I was doing. And I have carried that over throughout my life. I'm 92 now. And I have been working all my life. And I'm still working.
And so, Virginia, you have been such a keeper of these important stories. You commented working with labor unions and that you had worked with Martin Luther King. Could you just start from there? How did you meet Martin Luther King?
I met Dr. King when we were striking in South Carolina, and the union sent people down to walk the picket line and support the striking workers in the hospital. And they were mainly women, black women, who were striking. And he was very, very supportive of us. Every year he would come and speak. And we called it Day of Solidarity. And I must say, I was very introverted and shy when I went to work for the union, but it gave me a lot of courage, walking the picket lines and demanding our rights. And it formed, I guess you would call a defiant spirit. And that's how I met Dr. King, from the strike we had in South Carolina. When I was working for the union, fighting for the rights and maintaining the contracts that we had won, because, you know, it's so easy for management to forget about the contract, go back to the old ways, but you have to keep them on the straight and narrow.
You said up on stage today that you continue to work. There are things that you're doing with your community, volunteering at different museums, knocking on people's doors, making sure that they know about upcoming elections. What are those other things that you continue to do to actually nurse and take care of your community?
Voting. And that's the big thing with me. I think that each and every one of us should bring 10 people to the polls. You know, don't go alone.
Don't go alone.
Always take someone with you when you're going to vote, because the vote is where we have the strength.
Did you ever think about nursing as being an act of social justice?
Yes. When I started working for the union.
Welcome to the 2023 DNPs of Color Signature Panel Roundtable Discussion. My name is Dr. Sandra Davis. I am the Deputy Director for the NLN Walden University Institute for Social Determinants of Health and Social Change. I am excited, delighted, and honored to be the moderator for this exceptional forum. Seated with me on stage are 4 extraordinary nurse leaders who are shifting entrenched power dynamics by blazing new trails of opportunity and changing the game.
I am Dr. Walina Gould. I'm basically changing the face and culture of nurse anesthesia for almost 20 years now. I'm the founder of Diversity Nurse Anesthesia Mentorship Program. We mentor historically excluded nurses of color going into the nurse anesthesia profession. We have 3 initiatives. We have a diversity CRNA information session airway workshop. The second initiative is Diversity CRNA HBCU and Hispanic Serving School of Nursing Tour. And the third one is the Diversity CRNA Doctorate Symposium, where we have CRNAs, nurse practitioners, certified nurse midwives, PhD researchers, and we all are talking about our own trajectory. We're all talking about why we went into our profession and what we're going to do about it. And that's important because when I was in nursing school, no one said anything about any of that, right? So it's important. By the end of this year, over 800 nurses of color would have become CRNAs throughout the country.
My name is Meedy Barnelli, and I'm the proud founder, CEO, and president of the Black Nurse Collaborative. And we are changing the face of nursing by using our collective influence to make sure we leave a lasting impact. We had our very first amazing opportunity this earlier year in May, where we had the state of Black health according to the Black nurse. And so it was an amazing opportunity to simply build community of amazing nursing professionals from the bedside all the way to the C-suite to figure out how can we collectively gather and support each other. How can we also create pipelines and pathways for other nurses to enter into the profession that look like us? And also simply how can we create community and support each other as we continue to climb this ladder, what we call healthcare. I'm also chair of the DC Board of Nursing here in Washington, DC, and I'm super excited to be here.
My name is Dr. Lucinda Canty. I'm a nurse midwife. I'm a nurse midwife. I'm an associate professor of nursing and director of our Health Equity and C-Works program at UMass Amherst. Our goal is to increase diversity in nursing. And another piece that's important to me is that our journey through our nursing education is without trauma and harm. So I'll support students wherever they're at. Yes. So my research focuses on uplifting the voices of Black women, uplifting our history, our experiences, and that is what guides me through the work that I do. Because we have a right to be here, we have a right also to have good experiences of care. So that's my driving force. And I'm founder and director of Lucinda's House to address maternal health equity. My goal is, and I'll talk about this more, but using the structures that oppress us to liberate us. So that's my purpose.
Hey y'all, I am Dr. Danielle McCamey, the founder, CEO, and president of DNPs of Color. Y'all about to make me cry up here. My claim to fame is I build communities that create opportunities for nurses of color through networking, mentorship, and advocacy. And you all are the representation and manifestation of my vision and dreams, and appreciative of that. My day job, I am the Assistant Dean for Strategic Partnerships at the Johns Hopkins School of Nursing.
Thank you very much. In 1993, the landmark article, Racism in Nursing, by Dr. Evelyn Barbie, was published in the Medical Journal of Anthropology. In this article, Dr. Barbie discussed the harms of structural racism, structural violence, and how nursing needed to address the problem of racism in the profession. The word racism and any discussion of the topic was taboo, and the problem continues. We all know there's a problem. We all know something needs to change, but you stepped up and you stepped in and you are leading the needed transformation. We want to know about the factors or the influences that coalesced and are driving you to change the status quo, to shake it up, to invent, to create, to lead, to transform, and to do it with such passion and commitment.
We're all doing this work, yes, for us professionally, but we're doing the work ultimately for the patient. That Black and brown patient who's experiencing every day disparities and inequities, and that's why our voice needs to be heard.
Episode 44, way more than a health plan.
My name is Karen Dale. I'm the market president for AmeriHealth Caritas District of Columbia. It is a health plan serving little over 100,000 district residents, providing the full benefits that they deserve to help them to be healthy, well, and resilient. My other role is at the AmeriHealth Caritas family of companies, where I'm the Chief Diversity, Equity, and Inclusion Officer. Ensuring that we accelerate our progress in these areas, we build a strong leadership competency, and we are metric driven in order to achieve superior outcomes so that our workforce is more diverse, health equity is achieved, and we leverage strategic collaborations to support communities across the regions that we serve. I'm on this journey to get people to not talk about underserved communities, to avoid the deficit-based language. People aren't underserved because there's something that they need to do, should have done. Communities are under-resourced because of decades and really hundreds of years of racism, redlining, discrimination when they go to get a job, go to get a loan, right? All of those things are what have caused us to have communities where we see the inequities. And so I'm really always happy to say I work at AmeriHealth Caritas because we care about that. We jump in with both feet to affect the delivery system and to advocate strenuously in terms of policies that align with the type of change that would help these communities to be stronger.
And finally, episode 47, a vote for mom's health.
I'm Congresswoman Lauren Underwood. I represent the 14th Congressional District of Illinois, and I'm a registered nurse. Let's talk about the Black maternal health work first. What's happening in our country is that Black birthing people are 3 to 4 times more likely to die from pregnancy-related complications than white women. And in my state of Illinois, they're 6 times more likely to die. And for every death, there are 70 near misses, 70. So we're talking about this dual crisis of maternal mortality and extreme morbidity, right? Severe morbidity. Now, to have the opportunity to develop not just one bill, but a comprehensive solution like the Mommy Bus is something that just continues to blow my mind. So in 2020, when we first introduced the Mommy Bus, it was 9 bills to comprehensively solve this crisis. We introduced it with then Senator Kamala Harris. She was our Senate lead, and it addressed everything from workforce issues, right? Growing and diversifying the perinatal workforce to dealing with this data collection issue that is happening all across the country. The maternal deaths are actually underreported. So as devastating as the statistics are, and as every story is, we know that there's so many more that we don't know anything about. And we have legislation to help incarcerated moms and veteran moms and social determinants of health and funding for community groups. We have bills to deal with innovative payment models, recognizing how much payment policy influences how health systems operate these days. When I think about this issue, so often we're asked to solve problems that don't have solutions or don't have obvious solutions or don't have evidence-based solutions. This is not that kind of a problem. This is a problem that has a solution. It's called the Mommy Bus, and we just need folks to support it. It will make a huge difference. We will absolutely save lives. The dangerous part of this disparity is that it persists regardless of income level. It persists regardless of education level. It persists regardless of if you are insured or not, if you got prenatal care or not. We need to have solutions like the Mommy Bus that are going to solve all dimensions of this crisis, including clinical and non-clinical factors, those social determinants of health, to make sure that we are creating an environment that helps improve the health status of everybody. So while we're having this conversation about a disparity impacting Black women, we also know that when you do these things, it helps all moms. All babies, right? And so when we talk about equity, there's some people who are just like a little resistant of that notion, and they think that they will lose because others benefit. And that is not at all the case, particularly on this issue.
On Juneteenth, we invite you to listen, learn from, follow, engage, and cite Black nurses and their groundbreaking work and contributions to moving health equity forward. You can find the link to our full playlist in the show notes. For See You Now, I'm Shauna Butler. Thanks for listening, and happy Juneteenth.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation, nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.